This episode of the Pain Education Corner is sponsored by the Comella Foundation. The Comella Foundation is committed to relieving pain naturally using osteopathic healing principles. Here at the Comella Foundation, we envision a world where people achieve their maximum potential by being empowered with knowledge and skills to heal themselves and others. This information is to be used for educational purposes only and not to be construed as medical advice. If you have any questions or concerns, please consult a licensed healthcare professional. Hello, it's Bill, the knee pain guru, and welcome to the Pain Education Podcast again. We have a special guest today. It's Dr. Iris Tian. She is an osteopath in the Asheville, North Carolina area. And today we're going to dig into insights in acute pain with her. So I'm very excited about that. Welcome, Dr. Tian. I really appreciate you being here on the show.
Hi, Bill. Thank you so much for having me. It's great to be here.
You have a great story. And I know you're going to be like, oh, not that story. But would you share, before we get into that story, would you share your background, your history, what brought you to this point?
Sure. I grew up in South Jersey and stayed in New Jersey most of my life, but I went to the College of New Jersey for undergrad, and I majored in health and exercise science and minored in Chinese. And so I've always been very interested in just health in general and exercise and nutrition, and always wanted to, so my mother was a radiologist in China. And so I grew up with that Eastern medicine background. And when she came here, she became an echocardiographer just because licensure and things don't transfer very well. And so I grew up in that background though, and I've always loved, I followed her to the hospital and would spend time with patients there and volunteered. And I just loved that connection that I had and relationships I've built with patients through that. And so I always knew I wanted to go to medical school. But when I was looking at medical schools, I only knew of MD school medical doctors. So when I did more research, I realized that there was a DO school. And I was like, what is Doctor of Osteopathy? I've never heard of it. And funny enough, the school I ended up going to, which is my number one choice, was Rowan School of Osteopathic Medicine. And that was only 15 minutes away from my house. So I had no idea, even though I just grew up living right by there. And I remember going there for a demonstration. They were doing osteopathic manipulative medicine and just basic techniques, but I was just so intrigued by what they were doing. The ability to be able to diagnose and treat with purely your hands is a huge asset, especially as a physician. Because you can do it in whatever setting. It could be a rural setting, it can be anywhere really. And got into DO school, and as a first year medical student, fell in love with OMM as expected. And I was able to connect with one of my mentors, Saj Survey, and he actually is a physiatrist. So he is in the field of physical medicine and rehab. And that's what I am in and what I'm board certified in. And he also specializes in acupuncture and osteopathic manipulative medicine. So it was kind of all the fields that I was interested in one. And he was just a great mentor, and continued on with medical school and went to Mount Sinai, Icahn School of Medicine at Mount Sinai in New York City, in Manhattan, for residency, and graduated in June of 2020, and worked the COVID units towards my end of residency, my fourth year. And it was tough. It was definitely eye-opening. And after that, I always knew I wanted to start my own practice, specializing in OMM, because the patients I've seen, the impact that I made with purely my hands and the techniques was really profound. And I've always loved the holistic approach to medicine. And that's really how all this started. And so I knew I wanted to open up. And after working the COVID units, I was like, all right, I don't really want to work for anyone anymore. I want to do my own thing because life is short. You never know. And I just, I'm just going to do it. So I moved from New Jersey to Asheville, and that's that. And we opened up in November 1st of last year.
So November 1st. So we're just into 2, 3, starting your 3rd month
Yes.
of
Yep.
being open.
Yeah.
That's very cool. And it's exciting to hear your passion for manual manipulation. I think it's an awesome skill to have and be able to help people with. So I'm pretty excited about that. And the big thing about the Comella Foundation is it's based on osteopathic principles. Like we want to help people relieve pain using osteopathic principles. So it was an absolute treat for our paths to cross.
Yes.
And to find out that you were doing manual manipulation in the Asheville, North Carolina area. So that's fantastic.
Yeah. And I think it's unfortunately like a dying art in a way. Only about 5 to 10% of DOs actually practice OMM. Even though everyone learns it, we learn 200 plus hours of musculoskeletal medicine and manual medicine during medical school. It's just that people choose not to later on.
Sure. Yeah, absolutely. Well, there's a different, I'd imagine there's a different business model that is involved in a doctor that would be focusing more on manual manipulation than it would be if they were in a, forgive the terms, I've heard there's a clinical setting and then there's a
like inpatient or outpatient setting.
Where you're working essentially in or attached to a hospital, and then when you're on your own, which is I believe the clinical setting.
There are OMM fellowships that where you do go into the hospital setting, you actually have consults. And when I was a student and as an intern and as a resident, I did treat my patients in the inpatient setting with like constipation is a huge factor post-op. And it helped a lot with just 5 minutes of like myofascial release techniques.
Nice. Yeah.
So things like that can definitely help.
Great. Now, here's where our conversation, I think, is going to be so incredibly valuable for those that are watching. And it's your experience in and around when you were starting up your practice and your injury. And there was a finger injury. If you could just share what happened.
Yeah. So I moved to Asheville area mid-June, and a week afterwards, it was basically a freak accident, but I lacerated my pinky. And so it lacerated right through both tendons, my left. Luckily, I'm right-handed, but it was my left pinky, and it went through the flexor digitorum profundus and the superficialis. So there's 2 tendons that help with flexion of the finger. And so it also went through the digital ulnar nerve on the side. So after that happened, I didn't even realize what happened. I looked down, I cut it on a coffee canister, and it essentially, I couldn't move it. And right away, I just knew, being in rehab, being a physician, dealing with, usually I see patients in the hand clinic for things like this, and I help them rehab. So I just knew it was bad news. So drove myself to the hospital, got everything taken care of, and then saw the hand surgeon, had surgery 4 days later for both tendon repairs and then the digital ulnar nerve allograft, and was in a cast for 2 weeks, and then a splint for another 6 to 8 weeks, and then doing occupational therapy for the hand every week or every 2 weeks or so. It's been, I would say it's been rough. Right now I'm almost there. I'm like maybe 85% there. I can make a full fist, almost, just a little bit left over. I still have some swelling. Surprisingly, it's been like more than 6 months now, but still a good bit of swelling. And it's a very slow progress, slow process. And I can see how it can be difficult for a lot of my patients. Like when I see patients in the hand clinic, when I'm during that, helping them with that rehab process, I prescribe occupational therapy or physical therapy for my patients. And They do come in very frustrated sometimes because the process is slow and we have to wait for our bodies to heal on its own. And that can take time, and that's different for each individual. And now I can understand why it can be so difficult, because when I started rehabbing my finger, I had to do home exercise programs and just like stretching and moving it passively in the beginning. And I had to do that every 2 hours. And technically you get a break when you're sleeping, but really like you should be doing it, every 2 hours. And it's hard when you're working, when you have a life, when you're going about your day.
Sure.
I even set an alarm on my phone, but sometimes I would just not want to do it. And I was pretty good about it for the first, I would say, month and a half or two. And then it kind of slowly, I was like, oh, I forgot to do it. So I did it maybe a few times a day. So I can see that it is very difficult to stay on track with therapy, but that's the important part, because you can go to therapy, but that's only a 1 hour session. Most of the work is going to be on your own, doing the home exercise programs, the stretching, the exercises that the OT gives you, and all of that. And it is frustrating. I didn't get the last, so I got flexion back in the PIP joint, which is that middle flexion joint and the finger. And that came back maybe around 3.5 months. But then the DIP at the tip of the finger flexion, I couldn't get that. I maybe 4.5, 5 months in was when I started to actually be able to flex it after the swelling had gone down a good amount. But that was frustrating because being in osteopathy, the field, I have to use my hands. So this whole time, so my practice opened in November. It got delayed because I had to work on my finger. And
Sure.
But it was good. It gave me time to really slow down and focus on healing myself and healing my body, and listening to my body.
Sure. What is so curious to me is the psychological aspect of pain and how it can be incredibly defeating. I mean, I experienced it myself. Dislocated my left knee 4 times, had reconstructive ACL surgery. They took out 2 pieces of meniscus, and that was the conventional medical model. And they're like, okay, well, this is what you got. And I still had lots of pain, lots of swelling, lots of discomfort. And that really started my path in terms of my own healing journey to get over pain. But there are times where you're waking up and you're just going, why? Why am I dealing with all of this? Why did this happen to me? Get into that little bit of, for me, it was victim mode. Like, this is never end. And for me, it was taking it baby steps, one step at a time to keep momentum forward. Was there any insights? I'm curious the insights that you gained in your own process, being both a patient and a doctor, osteopath at the same time, in your healing process with your finger.
I would say in the beginning, as soon as it happened, I just knew it was going to be a long road ahead of me. I just knew I couldn't move it at all. I looked down, it was a pool of blood. I was like, okay. Luckily it just cut through tendons and not the bone. So, and it was, so knowing that, having that background, I just kind of mentally prepared myself, but nothing really prepares you for things like that and really rehabbing and going through that process. And I do appreciate that I have been through this process so that I can better understand my patients for sure. And it was frustrating. When it first happened, I was in a cast. I couldn't really do much, even showering, everyday activities. I couldn't carry any, things that people don't really realize or that you don't even think about. Being in rehab, I do think about it more than maybe other specialties, because I do help people from traumatic brain injuries, a spinal cord injury to ankle sprain, whatever it is, I do help them get back to functioning at their maximum and improving their quality of life that way and getting back to their baseline function. But it's different when you're the patient and actually going through it. And in the beginning, I would say, self-diagnosed clinically depressed, because I was like, well, I can't start my practice. I don't even know my finger is going to work. Luckily it's the pinky, but I still need my pinky for certain things. But grip strength is really important, that people don't think about. You're like, oh yeah, you don't need your pinky, but if you grip something right now, like grip a pencil or a pen, most of that strength is coming from that pinky. So index, or the ring finger and the pinky, but mainly the pinky. So I just knew I needed to focus on rehabbing it and just stay diligent, and tried not to get distraught over it. It was tough, but I just kind of took it day by day, and just focused on every 2 hours, just moving it and really focusing on that.
That in and of itself is challenging. But now I could put myself in your position, and it's like you just moved to a new city.
Yep.
You're trying to open up this practice. Your support system isn't there. So you don't have your family, friends, loved ones close to you. You're all these new people. And now it's like you have this finger thing that you're supposed to deal with every 2 hours. That had to be incredibly challenging.
Yes. And it was all major life changes with the move and the injury. I've never had surgery before. So it was just a lot of new things happening at once. But that's life, and you get through the obstacles. You just have to take it one day at a time. And that's what I did for my finger, and not, 100% there yet, but it's definitely so much straight. I couldn't even straighten it like this before, in like 2.5 months ago. So it just takes time. We just have to be patient with our bodies.
Totally. Yeah. I get it. And I think that is, in my experience working with clients, that is one of the biggest landmines and pitfalls, is that we aren't patient with our bodies, and we want to get back and do something before it's time. And then we end up injuring something even worse again.
Yeah. And in a society with instant gratification, everywhere, it's a quick fix. Like, our bodies don't work that way. You have to nourish it. You have to, give it the nutrition it needs. And that was something that was important. When I was, after my injury, I was making sure I had like enough collagen and vitamins and everything, and really focusing on that as well as the tendons were repairing and all of that. So that's something that a lot of people don't think about, I guess, either while they're healing.
Thanks for tuning in to today's episode of the Pain Education Corner. If you have a special talent or skill to relieve pain and you'd like to become a guest on our show, visit us at thecomellafoundation.org/interview. Help us spread the word on eliminating pain and suffering in the world. That's thecomellafoundation.org/interview. Oh, great subject. Talk about the collagen, talk about the vitamins you used. That would be great, as far as like the healing and recovery that you were using. What was your source of collagen that you used?
Honestly, I have the bottles over there in the kitchen.
But was it a topical, or it was a?
Oh no, it was like vitamin, like pills.
Okay.
Yeah.
So it's collagen. And then were there other specific supplements you used to help with your process?
Vitamin E oil helps with like skin healing and repair. I also did take vitamin E tablets, supplements. Trying to think what else that I had. That was the main thing, but really with any kind of muscle when they go through and do the operation, you're cutting through all the structures in that area. So I was making sure I got enough protein just with the healing process, and just drinking a lot of water, and really just filling my body with everything that it needs to repair itself.
Excellent. So let's switch our direction a little bit, and let's talk about how you work with clients, how you work with people, basically the setup of your practice in the Asheville area. What is your approach to, okay, we'll do this. Dr. Tian, hi, I'm Bill, and I have a knee injury. Tell me how could you help me?
Yeah. So, first thing I do is actually hop on a free consultation, phone call or video chat, just because I want to make sure that I'm working with someone who wants to be proactive about their health and wants to focus on preventive medicine. So not just taking care of the injury itself right then and there and right now, but how to prevent it in the future, how to prevent other pain and injuries in the future. And my focus and how my practice is shaped is really focusing on the patient being an equal partnership in a way. So my patients have a say in their health, essentially. And I want them to take control of that and really focus on that. And so I give them the tools that they need, and I provide them treatment sessions with osteopathic manipulative medicine so their bodies can heal itself. But they need to put in the work as well with the nutrition aspect, with the exercises that I give them, with everything else that we discuss. And so I'll just hop on the call, just ask them a little bit about, how long they've had the injury, how long, what they're feeling, how severe it is, and a few other questions like that. And then really getting an idea of what made you want to reach out to me, and have they heard of osteopathy before? Are they looking for a more holistic approach to managing their pain and injury? And then once we have that discussion, we think that we're a good fit, then I have them come in for an initial evaluation. And my initial evaluations are very comprehensive. It's about 2 hours long, and essentially we're going through a complete history, and we're talking about minor and major trauma or injuries that they've had even years ago that may have precipitated the injury today. Because oftentimes we don't think about. Prime example I always give is I had a patient that had chronic headaches, and she played volleyball when she was younger, and she had sprained her ankle before, and she didn't think anything of it, but that happened quite a few times. And the more I dove into it and treated her, I realized that her headaches stemmed from the ankle injury from 20 years ago. So it's things like that, because our bodies are interconnected, mind, body, and spirit. That's one of the tenets of osteopathy. And so if one area is dysfunctional, what we call it, then it can affect other areas in our body, and it can lead to pain and injuries down the road. So, so that's what I focus on. So it's not just, hey, you come in with knee pain. We're not just focusing on the knee.
Right.
Even as a physical therapist or anyone in this field, I'm sure know that you don't focus just on the knee. You want to make sure that the ankle is good. You want to make sure the hip, every level above and below, you want to check, because everything's interconnected in that way. And so we just try to make sure with osteopathy, it's really getting down to the key lesion, what we call it, the root of the problem. Sometimes when we're having issues with a certain area, that might not be the root of the problem. Like with my prior example. Sure. So that's where I come in to help the patient figure that out based on what I feel with my hands, with the osteopathic manipulative techniques, and all of that. And then we just go from there. And usually by the end of the initial evaluation, after I've diagnosed a head to toe exam, and I treat as I go, essentially. And then I'll have a better idea just based on how the patient responds during that treatment session. But also I try to see them back within 2 weeks or so after the initial evaluation, just to see did their bodies respond well? What kind of symptoms or what are they feeling? Usually you might feel a little bit sore within 24 to 48 hours afterwards, just because there's a lot going on. You may not feel it because I use a more direct, gentle technique. I use cranial osteopathy, which is a very gentle technique, and really focusing on the cranial rhythms, the primary respiratory mechanisms. So now I'm like diving into a whole other thing, but
That's
so the
great.
primary
You're perfectly fine. I
Okay.
love this. This is fantastic. So we could roll with this too. I'm
Okay.
good with that.
Yeah, so we think of respiration as like breathing with through our lungs, in and out. But the primary respiratory mechanism based on cranial osteopathy is actually in the cranial region, in the cranial bones, and the cerebrospinal fluid that flows throughout from the brain to spinal cord and bathe everything, the nerves. So when that primary respiratory mechanism is depressed or very heightened, it can lead to a lot of issues. Primary example, if the structures in the cranium are compressed, it can lead to depression. And the opposite, if it's very erratic, it can cause anxiety symptoms. So that's something that a lot of people don't think about either. But also along with that, a lot of everything is interconnected. So you have fascia that connects the back of your occiput, the back of your head, all the way down to your tailbone, your sacrum. So any part of that, if something is dysfunctional along that line, it can lead to pain in the body all throughout, because the spinal cord is really, the nerves stem out from that and control, stimulate the rest of the body. So it's very important just to make sure that everything's moving, everything's balanced as it should.
And this is fantastic. I love when someone such as yourself that's very proficient in working with the body sees those connections and recognizes those connections, and how important it is for other people to realize when you're experiencing acute pain that it's a result of all of these connections. Something got bound up somewhere, something stuck somewhere, and where we have pain may not be the issue.
Right.
It's somewhere else. And that a skilled person such as yourself that is able to take that level of history and have that specificity to go, oh, well, the headaches that you're getting is not just the headaches. It's because of that ankle injury you had in volleyball when you were in elementary school or whatever that is. And I think that is an art and a science that you just can't teach anybody. That is someone special. So I think that's fantastic. Well, we, as you had mentioned before, we live in that quick fix, fast society. It's like, deal with it now. We have the drugs, the shot, the surgery, whatever it is, to make sure the pain goes away. And a lot of times that drives the issue deeper into the neurology of our body that blows out sideways in some other way. And we can begin to stop that cycle. We can begin to stop that pattern when you go, oh, I need to get my ankle treated. I need to address what's going on at the source of it.
Yeah, I agree. And oftentimes when I'm treating patients, things pop up. Like as I'm treating, I equate treating a patient and what they're feeling to layers of an onion. So you unravel it as you go. There are things that maybe, because when you have like a major source of pain, so because you're the knee guru, so let's say knee, you're focusing on the knee. But once you actually start treating that area, you might realize so the pain goes gets a little bit better there. And then you notice, oh, maybe I'm having a little bit of like hip pain, or like this muscle I never even realized is like bothering me. And so that's the beauty of osteopathy, I think, is that you're not just treating what you came in with, you're treating the whole body. and you're getting down to the root of it, so that at the end, and it really depends on the chronicity of the injuries and severity and all of that and everything else going on in the body. But after a set number of treatments for that individual, and it's very personalized, so I can't say, 5 visits or, 10. But after a certain amount, they are, their bodies are able to. So essentially, the techniques I use help the body heal itself. So I'm just putting the body back into its certain positions that it should be in, that it likes to be in, away from the injury. But so that is balancing the tendons, ligaments, fascia, bones, and everything, all the structures in the body, so that on the patient on his or her own is able to just heal itself, essentially. And that's really what I'm doing, is just helping people along. So, but they're doing most of the work. And that's where, I provide my patients with exercises, and depending on the nutrition help they need, I provide them that. So everything, all the tools they need, so that their bodies can heal on its own.
Yeah, I love the premise of osteopathy, which is structure governs function. And if the structure isn't in place, if the body doesn't have things in the right place, it's not able to heal.
Right. And that's something that I think a lot of people don't realize. Like, prime example, in my field, there are people that have a lot of repetitive movements. So I'm trying to think. So maybe you work at your desk a lot, but if you have poor posture, you might have shoulder pain, like in the traps. A lot of people keep their stress in that area, in their neck area, and it gets tight. But if you have poor posture and your setup, your desk is not ergonomically set up, you're going to keep getting the pain, because how long are you sitting in front of your desk? Like, if you work an 8-hour day, it's going to come back. So really focusing on not just, okay, you have this pain, let's treat it, with these things. But if you don't change what a person does on a daily basis, they're still doing that, they're repeating that same pattern, it's going to keep coming back. And so that's where getting down to the root of it and asking questions like, what do you do for work, and, on a daily basis, or what do you do for exercise? Sometimes certain exercises, people aren't paying attention to form. They just want to lift heavier, for example. But then that leads to the risk of injury.
Yeah, it could get pretty, I'm guilty of that as well.
Yeah.
The ego kicks in, and it's like, yeah, I could do a little bit more weight. And then next thing you know, this just happened to me recently. I was working on a certain movement, and the weight actually went up. However, there was such a contraction in my neurology that I felt this real intense compression of my thoracic spine as a result, and up into the neck. And I've been working on it since. However, it's there. I think we're, as humans, we work with that, wanting that balance between improving and not letting the ego take over, and then not being a couch potato, not doing anything. So we're vacillating back and forth.
Well, it sounds like you might need an OMM treatment.
Yeah, I'm sure.
But also, I think the beauty of working in this field is we are more mindful of our bodies. And even my patients, once they get a few treatments under their belts, and really focusing on what they're feeling within their bodies, they're more self-aware. And I think that plays a huge role in healing our bodies and maintaining wellness in general. Certain things throughout the day, you're just more mindful. So when you go to pick something up that you dropped off on the floor, that's like one of the things that I really notice people having really bad posture when, they're hunched, they're like, flexing everywhere when they're going down, instead of keeping that straight back, that neutral alignment that they should. And that's what leads to injuries. So I also kind of focus on that with my patients and, everyday activities.
Yeah. So you're working with them. You were saying you're very comprehensive intake session with them. and you're getting an idea of what they do for work and their exercise activities and things like that. And in that, you're zeroing in not only on what's going on in their physical body, also what is contributing to their physical body from their life. So it's a very, very holistic and holistic and comprehensive is the terms that come to my mind, because it's not only looking at the physical body. And I think that's where many practitioners, doctors, when they work with a patient or a client, they're focused solely on the person that's in front of them and not what may have led them to be sitting in their office to begin with.
Right. And I think in my field in general, we are more aware of that in physical medicine rehab as a physiatrist. It's just one of the main things that we like, are you right-handed or left-handed? Because it's all about function. Like we want to make sure that you're able to get back to doing, if you're right-handed, we need adaptations. If you, had a stroke and you're hemiplegic, or just trying to adapt, giving them equipment or exercises that they need in order to help them get back to doing what they love, like hobbies, hiking, swimming, whatever it is, playing guitar. And so that's where I lost my train of thought. So
it's okay. I got a question for you.
Yes.
This will help. Okay. How do you see the balance between, and this is somebody that likes doing many, many things. The body needs a different adaptability to do many things than it does if it's just doing a certain set of activities. Is there the question's kind of there, but this may not come out completely well, but I'm trying to understand, is there a way of preparing the body, or with osteopathic manual manipulation, to prepare the body for many different types of activities as opposed to just certain specializations? Am I asking it right? Maybe I need to give examples or something.
Yeah, maybe an example would be helpful.
Okay. I'll use myself as an example. I have a homestead. I lift weights. I do martial arts. I have a daughter, so I play with her a bunch. Cook, do stuff around the house, taking care of animals. So it's a wide variety of different things that I put my body through. And sometimes something in that equation doesn't quite work out because it's so vast, it's so different. As opposed to if I just did a few activities, I just did stuff around the house, I sat at a desk, it would be easier to say, well, here is how I can prepare my body for all of these different activities.
Good question. I think regardless of what you do on a daily basis, it's better to be more active, but it's also important to pay attention to form as you go about your day. And I think it all comes down to the fundamentals, regardless of what activities you engage in throughout the day. I think really getting to the fundamentals of making sure that you have proper form. For example, when you're picking something heavy up, you're, making sure you have neutral spine, but also you're lifting with your legs and doing that squat instead of with your back. Along with that, a lot of people don't realize breath work is really important. So when you're going down to pick something up, you should be inhaling. And then as you exert, you should be exhaling. So you should exhale on exertion. And a lot of people don't do that. And when you don't do that, a lot of people hold their breath when they're lifting something heavy. And that's what weightlifters do. And they have the belts too, just to make sure that everything's like compressed in. But it helps with being able to lift something heavy, but that increases your intra-abdominal pressure. And over time, especially men and women, but especially women, you're increasing the intra-abdominal pressure, which affects everything within that, what we call the core canister, the diaphragm, the pelvic floor muscles, the back, and the abdominals. And over time, the pelvic floor muscles can get weak, and that's where people have urinary incontinence, bowel incontinence, especially after, if a woman has had children. But those are all things that lead to, that actually increase the risk of those issues later on, is going about your daily activity and, holding your breath when you're lifting something heavy, not paying attention to form. So that all affects later on down the road, help injuries to start up or pain to build.
Sure. And I think it's an unconscious level of tension that it keeps increasing. In the structure.
You don't feel the pain right away. You don't feel, the aftermath of what you're doing until maybe like 5-10 years later. Yeah.
Right. Got it.
Yeah. So to answer your question, I don't think that there's anything in particular that you would do differently or prep differently. I think it's really getting down to the fundamentals and focusing on form, which affects function.
Form and breath. I think that's a huge piece to bring to the table, and how it's all around us. It's constantly throughout our day, and we don't tend not to pay attention to it when we're holding our breath and when we're creating that level of tension in our neurology that just builds up over time.
Yeah. And I think it's just being more mindful of it. Even just listening to this podcast, for example, when I go outside and it's cold out, I tend to do this because I'm like, I'm cold. I'm like trying to get warm this way, but I'm, tensing my shoulders and neck, and I'm actually holding my breath sometimes. So when I see that and feel that happening, I'm like, okay, no, I had to relax and take deep breaths, and really just knowing that you have to do that. Over time, you develop it and it becomes more intuitive. And
and it's fascinating to me when you take understanding that structure governs function. When we hold tension like that, all of a sudden it starts to come, all of those areas that are getting tense are the areas that we're most likely to get sick in the winter. The throat, the sinuses, the cough in the lungs and all that, because we're holding our tension patterns like that.
And I definitely do see patients for like seasonal allergy, sinusitis, or just when they do have a cough or a cold. There are manipulation techniques that you can do to open up so one of the things, the terminal drainage sites in the chest, the substance fascia, oftentimes in people that have never been treated, which is a lot of people, it can be very restricted. And that's where all of the lymphatic drainage goes. And so if you think about it, if you're closing a door, like it's restricted, so it's not very open, and you have all this lymph buildup and drainage that's trying to heal and trying to get rid of itself in your body, there's nowhere to go. So you want to open those doors and make sure that the sites are not dysfunctional and not restricted, so that your body can heal and get rid of the infection and whatever else that's going on in the body. And there are certain like sinus techniques that you can do along the lymph nodes here, and also here and here. So
fantastic.
Yeah.
Well, Dr. Tian, thank you so much. This has been fantastic. You shared a wealth of knowledge, your experience with your finger, which I still hope it continues to improve. It's such a valuable perspective for those that are suffering in pain and going through it and feeling that overwhelmed and depressed, that both as a doctor and a patient, you have worked through that, still continue to be working through that. And that brings such a valuable perspective, I think, to the podcast.
Yeah. Thank you so much for having me. My practice, it's women's osteopathic wellness. It's the first and only concierge style practice working with prenatal and postpartum women and newborns, especially in the 4th trimester. We provide in-home services and also in-office and virtual follow-ups. But I do specialize in the perinatal population, but I do see anyone, I like to say anyone with muscles or a pelvis, which is everyone, that are dealing with pain. So yeah.
Perfect. And what we could do, we'll set it up. You had spoke about your consultations that you offer. What we could do is put a button down below this video on the page that this will appear on the Comella Foundation website.
Okay.
Where they can reach out to you directly and set up a consultation with you.
Yeah, that would be great. Everyone's welcome.
Perfect. And I'm going to dig in more offline. Want to chat with you about some real cool stuff we could do together here at the Comella Foundation as a way to help what you're doing and get the word out for more people to be aware of the wonderful services that you offer.
Yes, definitely. I'd love to chat.
Cool. Would you have any last words before we wrap up here?
Really just if you have pain and you want it to get better, you have to be proactive. You have to do the research and look out, in your area to see, who's around that has a more holistic approach, but definitely do your research in terms of, what you're getting yourself into, because some are not backed up by evidence-based medicine. And that's where we get into trouble as well. So having someone who is properly certified and also has the knowledge of anatomy and physiology is really important in order to help your body heal.
Certainly. Okay, excellent. Well, thank you once again. Really appreciate you being a guest here on the show. And we will definitely be in touch soon. I will definitely reach out and we'll connect on those other conversations that we'll have. This is Bill Paravano, the knee pain guru, on behalf of the Comella Foundation and the Pain Education Podcast. Wrapping it up for today. Have a wonderful day, and we will see you on the next one. Thank you for tuning into this week's segment of the Pain Education Corner. Join us next week for another conversation on natural healing methods to eliminate pain. To learn more about the work we do at the Comella Foundation, please visit our website at the Comella, COMELLA foundation.org.